Welcome to the future of medicine. Welcome back to Zero Fat TV Think Different, the channel where we challenge the status quo and explore the cutting-edge breakthroughs shaping our reality. Today, we are diving into a medical milestone that sounds like it was ripped straight out of a science fiction movie, but it is happening right now in 2026. We are talking about the world's first successful live surgery performed entirely by teleoperated humanoid robots. If you thought artificial intelligence was just going to write your emails or generate art, you need to brace yourself for a world where machines are literally holding the scalpel. Let's break down exactly what just happened and why the medical field will never be the same again. The historic live surgery breakthrough. Just recently, a groundbreaking study published in the journal Nature revealed that a team of brilliant engineers and surgeons at the University of California, San Diego achieved the unthinkable. They successfully utilized humanoid robots to perform minimally invasive gallbladder removals on living preclinical subjects. Unlike the bulky, specialized robotic arms we have seen in hospitals for years, these are bipedal, human-shaped machines navigating a standard operating room. The surgeons controlled the robots remotely using advanced haptic feedback suits that allowed them to feel exactly what the robot was touching in real time. This historic event proves that humanoid robotics have finally reached a level of dexterity and precision previously thought impossible. Why humanoids are replacing traditional tech? You might be wondering why we even need humanoid robots when we already have highly advanced surgical systems currently in use. The answer lies in versatility, mobility, and the ability to adapt to environments built specifically for human beings. Traditional robotic surgical platforms are massive, incredibly expensive, and require dedicated, retrofitted operating rooms just to function. A humanoid robot, on the other hand, can simply walk into any standard ER, pick up standard surgical tools, and get to work without any expensive room modifications. This incredible flexibility means that life-saving surgical capabilities could soon be deployed to remote clinics, disaster zones, and underdeveloped regions that desperately need them. Are human doctors actually being replaced? This brings us to the massive question in our video title. Are human doctors actually going to be replaced by these metallic counterparts? The short answer is no, at least not in the immediate future, because these robots currently still require a human surgeon to teleoperate them. However, the long-term goal is to integrate autonomous AI, allowing these humanoids to perform routine surgeries entirely on their own. Rather than replacing doctors, this technology is initially designed to act as a force multiplier to combat the severe global shortage of medical professionals. One top-tier surgeon could theoretically oversee multiple humanoid robots performing simultaneous operations across different continents, fundamentally changing how healthcare is delivered. The ethical dilemma of AI surgeons. Of course, as with any massive technological leap, we have to look at this through the think different lens and question the potential dark side. Handing over the literal power of life and death to a machine opens up a Pandora's box of ethical and cybersecurity nightmares. What happens if a hospital's network is hacked or glitches out during a delicate, autonomous robotic procedure? Furthermore, we have to ask ourselves if patients will ever truly feel comfortable being put to sleep knowing a faceless android is the one operating on them. These are the critical conversations we need to be having right now before this technology becomes a mandatory standard in every hospital worldwide. Final thoughts. To summarize today's incredible breakthrough, humanoid robots have officially crossed the threshold from science fiction into the operating room by successfully performing live surgery. This innovation promises to revolutionize global healthcare by providing highly mobile, adaptable surgical assistance in areas suffering from critical doctor shortages. While human surgeons are still at the controls for now, the rapid advancement of this technology points toward a future of fully autonomous robotic procedures. We want to hear your thoughts on this massive paradigm shift, so let us know in the comments. if you would trust a humanoid robot to operate on you. Thank you for tuning in to Zero Fat TV Think Different, and remember to always question the narrative, stay curious, and keep thinking differently.
Thanks for watching Zero Fat TV. Make sure to like, share, comment, subscribe. Life is trying things to see if they work. Rich Hamilton,